going to hear from Cecile Kazachkin, a senior policy analyst at the Canadian HIV/AIDS Legal Network, a nonprofit organization that promotes and defends the rights of people living with HIV and that are affected by HIV in Canada and internationally. At the Legal Network, Cecile works primarily on issues related to the criminalization of HIV, non-disclosure, drug policy, and privacy. So with that, I'll hand it over to Cecile.
Thank you very much, Rachel, and welcome everyone. Thank you for joining the webinar. For those who don't know about the Canadian HIV/AIDS Legal Network, we are a Canadian non-for-profit organization, and we work to promote and defend the rights of people living with HIV and those who are affected by HIV in Canada, but also internationally, and we do our work through education, research, analysis, advocacy, community mobilization, and litigation. So today, as mentioned by Rachel, we're going to be talking about the role of privacy and confidentiality. So some very important obligation for service providers in reducing stigma and discrimination within health and social services. So how can we actually improve access to services by really taking seriously the privacy and the duty of confidentiality that we have towards our clients? As you may know, the law with regard to the protection of privacy in Canada can vary from one province to another. So I'm going to provide some general information. I may not be able to provide an exhaustive presentation of all the obligation or the details around the law of privacy, how and how it applies in your particular situation. But I think this presentation will be a good opportunity for you to reflect on your own practice, on some general principles that are related to your obligation as a service provider when it comes to privacy and confidentiality, to reflect on the stigma and discrimination that your clients might be encountering, and how we can create safer space and more inclusive spaces for people who use services related to sexually transmitted and blood-borne infection. We will also be discussing some issues relating to some of ethical dilemmas that you may be facing when providing services. So for example, the dilemma that you may encounter when you, in one hand, you want to safeguard the privacy and confidentiality of your client, but you may have some other competing interests to take into account as well, including protection of others and protection of public health. And in particular, we'll be talking about these ethical dilemmas in the context of the criminalization of HIV non-disclosure and potentially of other sexually transmitted infection. As mentioned by Rachel, this is an issue that we work on very much at the Canadian HIV/AIDS Legal Network, and I think it's quite important to reflect on how this severe legal environment impacts practices of service providers. So we'll be talking about all of this today. And just before we get started, I also wanted to mention that the information that is included in this webinar is not a legal advice, and it cannot be used as a substitute for advice from regulatory bodies about professional obligation and practice standards. I understand that there may be some of you attending the webinar who might be from regulated profession, and therefore, again, these are important general principle that I think applies to everybody, but then it's important that everybody do a little bit of more digging to really understand what their obligation and what regulation actually applies to their own profession. So now I'm going to turn it to Rachel, who's going to introduce the notion of
Thanks,
stigma.
Cecile. So
That's
just
going to guide
quickly,
us
given
through
the
this
focus of
webinar.
today's webinar on stigma reduction, we just wanted to spend a few minutes really unpacking this term. So at this time, I'm going to invite you to use your the chat box just to brainstorm some of the questions found on the screen. So when we think of stigma, how would you define it? Where do we see stigma? And then what's the potential impact of stigma on the clients and the individuals that we serve? So think about the potential impact on the health and well-being of our clients, as well as how they access our services. So I'll just give you a few minutes to quickly type some of your thoughts in the chat function, and then we'll come back together to debrief. So Stan, thank you for that. So Stan shared stigma as feeling ashamed or embarrassed to identify with a certain condition or identity due to negative societal values. Certainly. Anyone else in terms of how we would define stigma or where we might see it? Yeah, so thanks, Christine. So Christine said there's a notion of victim blaming, like it's the person's fault or that they're sick. So often when we think about stigma, we're talking about stereotyping, assumptions. There's often, of course, a very negative connotation, and that can have serious implications for the client's health and well-being. In terms of where do we see it, generally we get a resounding answer that we see stigma everywhere. So stigma, the people that are accessing our services experience stigma in their everyday life, and then that carries over when they actually access our health and social services that we're providing. And the potential impact of stigma is far-reaching. It can impact health and well-being, and then it can actually impact whether or not clients choose to access the services we're providing. So I'm going to quickly just go over some definitions of stigma that are found in the literature, just because I think these definitions can be really helpful to actually unpack the term stigma, because it is quite complex and really can help to identify some of the interventions we can use to actually address stigma. So these terms are borrowed from the literature, and I'm going to quickly provide a definition of each. And then I would just encourage each of you, as we go through the content in this webinar, to reflect on these 5 different types of stigma. So the first is internalized stigma, and this is really referring to an individual's acceptance of negative beliefs, views, and feelings towards the stigmatized group that they belong to. And the next, looking at perceived stigma. So this is really looking at the awareness of negative societal attitudes, and then an actual fear of discrimination and feelings of shame. And this is kind of what you brought up, Christine, where there's a feeling of victim blaming and feeling like a person can be at fault for their illness. The next is enacted stigma, and this is what we most often think about. So this refers to overt acts of discrimination, such as exclusion or acts of physical or emotional abuse. And the next one, we're looking at layered or compounded stigma. And this is really just reflecting that folks have multiple lived experiences, and that a person may hold more than one stigmatized identity. And then lastly, looking at structural stigma. And this is really the stigmatization of a group of people through the implementation of policies and procedures. So again, before handing it back to Cecile, I would just encourage you to reflect on these 5 different types of stigma as we go through the content for the rest of the webinar.
Thank you very much, Rachel. And to go back to the law and how that, what the law in relation to stigma and privacy, I wanted to mention discrimination, which is when acted upon, stigma can amount to discrimination with it, which is treating a person differently because of a personal or a perceived characteristic. So Canadian human rights laws prohibit discrimination based on certain grounds, including age, race, ethnicity, color, religion, sex, marital status, disability, sexual orientation, and place of origin. And for your information, HIV is considered a disability under Canadian human rights law. So it is prohibited to discriminate someone based on their HIV positive status. And Canadian human rights law do protect patients. They have the right to be free from discrimination when they receive goods and services, and that includes the right to be free from discrimination when they receive healthcare services, whether they are provided by a hospital or whether they are provided by a service provider in private practice. So everyone has a right to equal treatment when they receive healthcare services. So that's very important. And I also wanted to highlight again that by guaranteeing the right to privacy and confidentiality of people, and we are helping to protect them from stigma and discrimination, and stigma in all the different forms that Rachel mentioned, whether by respecting their privacy, we are protecting them from the internalized stigma that they may be experiencing, or if we are also protecting them from being treated differently because of their HIV status, for example, or because of their sexual orientation. And this is very important in the context of the services that you are providing in relation to sexually and transmitted infection. So what is privacy and what is confidentiality? Because I keep repeating those terms, so it might be good to define them. Privacy is a fundamental right, which is recognized in international human rights law and in Canadian law. It's if we try to define it, it's really the right to control or consent over your personal information, how they are handled by others. So it's really the idea is that personal health information really belong to the clients, and they have a right to control or consent to how their personal information is handled by others. So of course, by imposing a legal obligation not to reveal personal information without consent, the duty of confidentiality is one way that it protects individual privacy. And so the duty of confidentiality, which prohibits to disclose information without someone's consent, is one way to ensure control of your clients over their personal information. But we'll discuss during today's webinar other forms as well of respecting privacy that goes beyond the issue of confidentiality. And why the issue of privacy and confidentiality are particularly important in the context of STBBI services is because when accessing those kind of services, it will be very important for your client to be able to share sensitive information about their health status, but also maybe their sexual practice, disclosure with sexual partner around their health status, other behavior such as substance use, etc. That may be extremely sensitive for them, and could be also, as discussed before, sources of stigma and discrimination, whether it's in the services or outside services. So it's extremely important to ensure confidentiality and to create a safe space for clients so they can share those intimate details and personal experience without the fear of losing control over their personal information or being exposed to stigma and discrimination. So this is why it's privacy and confidentiality is a cornerstone in service provision around health, but it's also especially important in a context where clients might be really worried to actually access services or talk about things that are important to their care, but that they see might result in them being treated differently, or who may be very worried that if they disclose that information, that information will be shared with others, including outside services. So, indeed, as already mentioned, I think in the context of sexually transmitted infection services, you might encounter service user who experience multi forms of stigma, as we discussed before, enacted, perceived, etc., but also different layer of stigma depending on what's their personal situation. So they might be experiencing stigma because of their HIV status, or because of their sexual orientation, or their gender identity, or because of their race, because of their drug use, or maybe because they are engaging in some behavior like sex work that is continue to be highly stigmatized. So the people that you meet in your services may have, previous bad experience in accessing healthcare, and it might be difficult to preserve trust and actually have open conversation with people. And this is where really showing that you take confidentiality and privacy, and that you really respect that their personal information is belong to them, and that they have control over it, is really important to protect them from further stigma and discrimination, whether it's internalized and how they perceive it, or whether it's how other people will be treating them if the information was available. So again, you can use your chat box. I just wanted you to reflect a little bit on why do you think, like, what may even appear as a minor violation of your client privacy and your duty of confidentiality, how, like, what could be some of the severe ramification in the context of service delivery, or outside, if those obligations were not respected. I just wanted you to think about, like, for example, what if one of your client, was gay, and came from a community where homosexuality remains highly stigmatized? Why do you think for him any violation of his privacy around his sexual orientation could be very damaging? So this kind of example. So I'll give you like 2 minutes to give some thoughts. Yeah, absolutely. Shen and Samantha, thank you very much for your contribution. So you're saying that uh, violation of confidentiality and the right of privacy will deter people from seeking further care, not wanting to get treatment and get further support in the context of sexually transmitted infection. It might also deter people from getting tested in the first place. And Sarah, you mentioned as well that it creates a mistrust in health services. And Selina, you're right. It would be very embarrassing for the organization as well. And actually, it would be, legally speaking, it would be a problem for the organization as well. And there could be some legal consequences, as you mentioned, Selina, like privacy complaints, etc. So Yes, indeed. Even what may seem like a minor violation could have like a huge repercussion. So, for example, like there's been a research done by Marie-Liv Gagnon around HIV-related stigma in healthcare settings, and some examples of like the stigma experienced by people, including, you know, have service provider warning colleagues in front of everybody that the patient was HIV positive, which we can imagine how like that could reinforce the internalized stigma experienced by this person and making that person feel very bad when accessing care, and how this is not going to make this person access care anymore. Or another way of uh, other example that she found uh, was also labeling someone as someone who used drug with other colleagues, and other colleagues then being very judgmental with that person. So those are kind of repercussion, direct repercussion that can happen if this personal and very sensitive information are too easily shared and not, and the confidentiality not respected within the services, but then also outside the services. So, for example, disclosing to sexual partner that they may be at risk of HIV because your client is HIV positive, and they have not disclosed that information to their sexual partner, could have huge repercussion on your client, who might be at risk of violence or abuse, but also potentially at risk of criminal prosecution if that partner decided, who was not informed, decided to press criminal charges. And we're going to talk about this later in the webinar. But again, so what may seems to be even a minor violation could have really serious ramification. So, as mentioned before, the protection of the right to privacy vary from one province to another. Privacy law in Canada is quite complicated. It's been described as a patchwork of rules. But that being said, there are some general principles around the collect, the use, and the disclosure of personal information that are likely applicable across the country, and this is what we're going to focus on today. So to determine what laws applies to any particular situation, it can be challenging because again, it might vary depending on where you are practicing, but it will also vary on whether a service provider engage in a commercial activity or whether they are a member of private or public sector. And also very important, in many provinces in Canada, there are specific legislation around personal health information that impose obligation on certain professionals, such as nurses or physicians and other, to protect health information. So this, when it comes to health information and those particular professional, this is the legislation that will apply. And also, as mentioned before, some of you and some service providers in one organization might be governed by code of ethics rules and standards that are specific to their organization. That would be the case for nurses, for example. So it's really important to realize that an agency may actually have different rules applying to different staff members, and that service providers as well as the organization are familiar with all the applicable legislation. There are some useful resources on privacy legislation in Canada, especially on the website of the Office of the Privacy Commissioner of Canada and the Canadian HIV/AIDS Legal Network. We also have some Know Your Rights privacy info sheet that may be useful to you if you want some more information. So, respecting clients' privacy this is respecting, as we said, the idea that personal information belongs to the clients, that they have the right to control their information. So, of course, first of all, respecting the duty of confidentiality is essential to respect your client's privacy. So the duty of confidentiality, as mentioned before, is the fact that you are not allowed to reveal personal information without a client consent. I thought it would be important in this context to specify that service providers' duty of confidentiality is not limited to just a client's health status, so a client's STBBI positive status or other health condition, but it really extends to all the other personal information that a service provider may receive in the context of counseling, care, and treatment. And again, this is really important because those information might be the very kind of sensitive personal information that can result in experiencing stigma and discrimination by your client. So any discussion that a service provider may have with a client about their sexual activity, their sexual orientation, their gender identity, their challenges around disclosure to partners, all this information are also confidential information and therefore are to be kept confidential. And now I wanted to make you work again a little bit and just to take a time to reflect on your own practice and whether you actually discuss the your duty of confidentiality with your client. And if so, I was wondering, what do you tell your client about your duty of confidentiality, and why do you think it is important to have some discussion around this when interacting with your clients? So again, you can use the chat box to write your responses, and I will read them out loud. So think about when you're like meeting your client for the first time, is there any discussion around the duty of confidentiality and what it means? So Selina just shared some information about how they work in their agency. So she said that they have their statement of information practices posted in client settings, and it's part of our script when they are interacting with clients. It is important to talk about the issue, the duty of confidentiality, so people can know their rights, including the right to withdraw consent. Yes, Selina, this is really interesting what you're saying. So you're saying that you are engaging with this with clients in providing clients with information around their duty of confidentiality, and I imagine that will encompass the limits of confidentiality, and the idea is really so the client can make an informed decision about whether they will disclose and provide consent to to the collect of their information and use and potential disclosure to others. And indeed, it's really important to have those conversations. I mean, I know that sometimes it may feels like we don't have time to do it, but clients have a right to know how service providers will use their personal information and with whom it will be shared. And we know that there are circumstances where the law authorizes or requires service provider to disclose confidential information, and we'll discuss that again in the webinar. And clients should really be made aware of such limitations so they can really make informed decision about how they want to share some personal information with service providers and when they are accessing care. And that's really important also to build this trusting relationship, because from the beginning, a client actually knows what are the rules, and won't have some bad surprise. So really discussing the potential limits of confidentiality allows client to control and consent to how their personal information is handled by others, and ultimately that can serve to reduce the stigma and discrimination. So Selena also mentioned that they provide logbox options for clients who don't want to share results with other healthcare providers. Thank you. I don't know if everyone on the webinar is familiar with the notion of logbox. We'll talk about it a little bit later in a few slides, so I'll come back to that. But excellent point, Selena. Thank you for your contribution. So, okay, so we said it's important to talk about the duty of confidentiality. It's important to talk about the limits of confidentiality. So can we get a little bit more specific? I would think that generally speaking, clients should be informed of practices that they may not reasonably expect. So for instance, the fact that records can be seized under a search warrant in the context of a criminal investigation is some information that they may not be thinking about if they are not informed about it. Other exceptions to the duty of confidentiality may include an obligation to report a child in need of protection under provincial or territorial legislation. And in the context of STBBI-related services more specifically, I think it's important for clients to be informed, where applicable, of some of the public health reporting requirements as well. So for example, in some places, service providers and some service providers may be required by public health legislation to report known or suspected cases of reportable communicable disease to public health authorities. And it's important for people to understand what might be the consequences of such report, and that in some provinces, health professional or public health authority will likely ask or require, for example, that a sexual partner be notified if someone tests positive to STBBI. So that's the kind of things that is important to inform patients about, so they can really make an informed decision about getting tested in the first place, and because then they will know what's going to be the implication of that information being available to public health, and what are going to be the implication in terms of who's going to be informed about that diagnosis. So this is why I think this is especially important in the context of pre-test consenting for STBBI. The legislation and the reporting requirements will vary from one province to another. So if you want to have more information around that, I would recommend checking public health website in your province to find more information about the reporting requirements. And I know that talking about the limits of confidentiality may sound counterproductive to some health professional or other service provider. Some may worry that by informing clients about the limits of their duty of confidentiality, or but the right their right to refuse to provide some information, that may discourage a client to be open, or that may even discourage in the context of testing, STBBI testing. But I think it's actually the contrary. By being fully transparent about their obligations, service providers will really show respect for their clients' right to privacy and for their autonomy. And I think that's really important to set the ground for a healthy and trusting relationship. And again, very important in the context of STBBI-related services because of the legal context as well surrounding STBBIs and especially HIV. And so it's really important that people have all the information at hand to make informed decision about accessing care and accessing testing. So respecting a client's privacy, as I said earlier in the webinar, goes beyond keeping information confidential. It also means refraining from asking unnecessary, intrusive questions to a client. That's also respecting their right to privacy. As a general principle in privacy law, personal information can only be collected if it is limited to the purpose for what it is collected. So service providers should really only collect information on a need-to-know basis. And therefore, that means they should only ask questions that are relevant to the client's care when we are talking about services, healthcare services related to sexually transmitted infections. So only ask questions that are relevant to the purpose for which the information is required. Only ask questions that are related to the care. If a service provider asks a question that is unnecessarily intrusive or rooted in bias and assumption, this can compromise the client service provider's relationship. It can also perpetrate stigma, whether again internalized, perceived, or enacted, and it can foster non-disclosure by discouraging people to actually be open about their personal situation because they won't trust that their information will be well received, and they might be treated differently if they disclose that information. And people may also just choose to disengage in care and access other services if they feel they are being asked, unnecessary question and feel very uncomfortable about those questions. So for example, asking a transgender person a question about their genitalia or surgical status out of curiosity can quickly create a discriminatory environment. So that might be one example. Or, a sex worker might be reluctant to seek consenting from a physician if they have past experience with inappropriate questions or assumptions about their sexual life because of the work they do. So it's really important for service providers to be aware of that, to think whether their question is actually important, relevant, and to think about their own bias and assumption when thinking about why they are asking that question. And again, I said it again, I said it before, but I'll say it again. It's important to remember that ultimately personal information really belongs to the clients. So it's the client's right to decide whether or not to disclose certain information about themselves, even if you think that's relevant to their care. And it's their right to disclose the information, for example, related to their sexually transmitted infection positive status. In some circumstances, clients may choose not to disclose their STBBI positive status to mitigate the impact of stigma and discrimination, including, for example, as mentioned before, to avoid inappropriate question or because they are worried that they might be discriminated. And so it's important to respect that right of the client to really decide whether they to disclose or not. And healthcare professionals do not need that information to protect themselves when they are practicing, because they should be using and applying universal precaution regardless of whether they know the status of their client. So this slide is just some of the things that you may want to just keep in mind when interacting with the clients, and about how to interact with the client in a way that is respectful of their privacy and their space. So really, it's important for service providers to be aware of your own attitude, values, and possible bias. I mean, everybody has those, and so it's important to be aware of this and reflect on those. It's also important to be aware of factors that may impact your client's capacity to disclose some personal information, or the way they might receive some questions. So, for example, again, some of your clients may have difficulty sharing some personal information with healthcare providers because they had bad experience in the past, or for some clients it might be very difficult to talk about their sexual life because they've been victim of sexual violence, or they are currently victim of sexual abuse, and so those questions might be really triggering and difficult. Know also why you're asking a question, and ensure that it's relevant to the care. And again, remember that questions should never be asked out of curiosity. And as appropriate and as much as possible, take the time to explain why you're asking a particular question, especially if it's sensitive, and you can imagine that maybe your client might not receive well your question and might be wondering whether you're asking unnecessary intrusive question. So just if it's relevant to the care, take the time to explain why. And also mention that they are not obligated to answer the question if they do not feel comfortable discussing it. And other tips could be to use simple, non-judgmental, and understandable language to avoid any misunderstanding. And again, be upfront about your duty of confidentiality and potential limitation. So this is those information are important for you when you're like discussing with your client and interacting with your client. And going back to how the information is going to be used once collected and how it's going to be disclosed to others, I wanted to talk a little bit about disclosing confidential information in the context of providing care. And this is where we will go back to what Selina mentioned around the logbox. So the question here that we're addressing is whether service providers can actually share confidential information about their client without necessarily asking for their express consent, if this is for the purpose of providing care, and if this is in the context of relationship with other healthcare providers. So healthcare professionals, and I'm insisting that this is specific to healthcare professionals, are often entitled to assume that their clients have consented to the sharing of their personal health information with other healthcare professionals involved in their care. So that includes health professionals that may be working in different organizations. So the practice is called sharing information within the circle of care. So while in most cases, clients' health information can only be disclosed with their consent, the consent does not always need to be expressed, so stated verbally or in writing. In fact, if you're a healthcare professional, you're entitled very often in many provinces to assume that your client has consented to you sharing some information to other health professionals that are involved in care. But of course, it's not like every information that is deemed to be where there is some kind of implied consent, again, it's only necessary information that can be shared within the circle of care. And even when sharing that information, it's really important that service provider take steps to protect their clients' privacy when disclosing confidential information. So this is very important to ensure a non-stigmatizing and non-discriminatory environment. Again, think about the example that I took before, where a physician would tell another member of the team, out loud that this person is HIV positive and that maybe they want to be taking extra precaution, and how even if they might be entitled to share information around that person's HIV status, the way it's being done could be really reinforcing the experience of stigma of that person when accessing care. So there are some exceptions into this principle of like health professional being entitled to assume that their patient has consented to the sharing of their personal health information with other health professionals that are involved in their care. And that's when actually a client say they do not want their information to be shared. There are several provinces and territories that in their legislation specifically provide for clients this possibility to tell a doctor you cannot share that information with others. And in Ontario, this is where we use the term locked box. So in those situations where a client has expressly told their healthcare professional not to share their information with others, even those who are involved in their care. So concretely, it might be, for example, like you're referring your client to another healthcare professional. Your client doesn't want that healthcare professional to know about their STBBI positive status, and so you're not going to share you're not going to include in the record that you share with that professional that particular information. So that's the lockbox kind of concept. Depending on the applicable provincial and territorial legislation, the health professional might still be able or even sometimes required to tell their colleague that there is some important information missing that they are not allowed to disclose because the client didn't want to. And it's really important to inform people about their right to about this right and this lockbox option, as mentioned, and Selena said that they talk about it with their clients. It's really important because some clients may have really good reason to ask for their information not to be shared with other health professionals, again, including fear of stigma and discrimination. And this is something that may not be necessarily evident to you, but they may have some really good reason to think that. So respecting privacy really requires service providers to respect your client's right to decide for themselves when and how their personal information will be shared, used, or disclosed. So, for example, imagine that you're a client that is coming into a health services in a small town, and at the same clinic, their brother-in-law is working there as a practitioner, and his brother-in-law doesn't know about his HIV status. And you can imagine like why this person might not want their brother-in-law to know, or a member of the family, and therefore this is when maybe they might want to ask for this particular information not to be shared with the entire team that's going to be working and providing services to him. So in other circumstances that do not involve healthcare professionals, so for example, if this is a disclosure to someone who is not a healthcare professional, it is important to ask for express consent before disclosing personal information. And I'm thinking now, including in like an agency where people, it's a community organization and people are not healthcare professional. They may want to seek express consent before sharing information about a client with other member of the team of the same agency. So moving forward, what do you think are some of the steps that organization can take to facilitate a non-stigmatizing and non-discriminatory environment through respecting and promoting privacy and confidentiality? Like, how do you think that we can improve, improve the protection of privacy and confidentiality in our agency and in our practice? What are the different things that could be done to do that? So we've already included some options of response in the slide that I would invite you to read, and you can say which one are applicable, and you may also want to add some other examples to the list. So I'll give you like 1 or 2 minutes to kind of reflect on what can be done from an organization perspective. I can see that some of you are typing, so I'm just going to leave a little bit more time. IDEA had a great idea. I encourage staff to consider how they would like their personal information handled when providing training support. That's a really good idea because indeed, I think we all have access health services, and so we all have an idea of how we would like our information to be handled, and that might be a really good way to think about it. Sean is saying that policy and procedures are only effective if applied, and is asking whether there is some kind of auditing or accountability process that I would recommend. I'm not sure that's a good question. There must be some sort of models for policies and procedures in regard to privacy and confidentiality. I think to make them effective and actually being applied, what would be important is to make sure that first of all everybody is aware of it, that those policies and procedures are easily accessible by clients as well and are understandable. Also, someone in the agency could be appointed to be in charge of privacy-related matters and make sure that be informed about any questions that are related to privacy and confidentiality in the agency, and also make sure that clients have access to some kind of and are informed about some kind of procedures and possibility to make a complaint if those policies and procedures that they've been informed about are not respected. So those could be ways to make it effectively applied. And Selina is saying also a step that is important is to be aware of the physical settings in which we see our clients to determine if the physical space is conducive to privacy. So I imagine that, Selena, you're referring to kind of like also how like things are in the discussion with clients are taking place. And so, for example, if you're talking in a room where in fact you're only separated with like a curtain, a very light curtain, and people can understand and hear the conversation, then you're not necessarily providing the sufficient space for privacy. You might also want to think about behavior outside the agency. So, for example, again, in small community, if someone is seen as knowing a person who works in a aid service organization, for example, that may imply that they are going to that aid service organization and therefore might be HIV positive. So you might also want to think about how to interact with clients when seeing them outside the agency and the physical space where you are working. So thanks again for your great contribution. So now we're going to look at the last part of the webinar, and it's dealing with the complex legal environment and ethical dilemmas that you may be facing. So as we said during the webinar, the duty of confidentiality is really central to providing services. It's very central to safeguard the privacy of your clients, and the idea that they are the one who have the right to control their information. And this is absolutely necessary for them to and for you to build a trusting relationship with your client. But the duty of confidentiality is not absolute, and in some circumstances it will have to be balanced with other interests, such as the protection of others or public health, and that may be very difficult for service providers to do. And I think these challenges are definitely exacerbated by the current legal environment in Canada that is very harsh and that imposes an obligation on people living with HIV and potentially people with other sexually transmitted infection to disclose their HIV status to their sexual partner, in the sense that that current legal environment reinforces stigma and discrimination against people living with HIV. It also kind of creates this atmosphere and environment where of extra surveillance of people living with HIV and extra kind of interference with their rights to privacy. And I think that can have an impact on not just on people living with HIV and how they interact with sexual partners, but also on how it has an impact as well on how they interact with service providers and on service providers' perception of what their client should be doing or not. So before I go to a little bit of more detail around like what's the criminalization of HIV non-disclosure in Canada, what's this legal environment that I've been mentioning, I just wanted you to take again 1 minute to kind of reflect on why do you think disclosing your HIV positive status or taking precaution to reduce the risk of transmission to a sexual partner might actually be not that easy to do for people. And think about some factors that may affect a person's capacity to disclose their status or take precaution to reduce the risk of transmission. So we have different options on the screen, and you should feel free to say what you think about those options, but also add other examples if you have some in mind. So why do you think it might actually be difficult for someone living with HIV to disclose their status to a sexual partner? Sean said fear of criminalization, and I think that's correct. In the sense that even if the criminal law would actually impose a duty to disclose in some circumstances, some people might be afraid that as soon as they disclose that their sexual partner could use that information against them. And we've seen some cases where people have been victim of threat by their sexual partners. Um, so their sexual partner saying, you know what, if you leave me or if you don't do what I want you to do, I'm gonna go to the police and I'm gonna tell them that you have not disclosed your status to me, and anyway, there is no way you can prove it. So you see, even this obligation by the criminal law to disclose your status could be a source and a factor of non-disclosure in the first place. And I think there are many other factors that also explain why someone might find it very difficult to disclose their status to a sexual partner, and that include, fear of rejection, fear of any kind of negative consequences if they disclose their status, in terms of possible abuse, possible violence, stigma and discrimination again. Also, many people are worried that if they disclose their status, their confidentiality will not be respected. So that their partner might tell everybody that they are HIV positive. So those are real concerns, and I think it's really important to keep those in mind when kind of thinking about your role and how you interact with your client and how you discuss issues around sexual practices and disclosure in this very difficult legal environment surrounding HIV. So what does the law say? I don't know if many of you on the webinar are aware of Canadian criminal law around STBBI's sex and disclosure. So in a nutshell, under Canadian criminal law, people living with HIV have a legal duty to disclose their HIV positive status to their sexual partner when they engage in sex that poses a realistic possibility of HIV transmission. So it's not before any type of sex that people have a duty to disclose. It's when there is a realistic possibility of HIV transmission. And whether there is a realistic possibility of HIV transmission and how this is being interpreted is kind of left to the courts. It's important for you to know that most often people are charged with aggravated sexual assault, which is extremely severe criminal offense that carries a maximum life imprisonment penalty and registration of sexual offender. And that can happen even when no transmission occur, and even if the person had no intent to harm their partner. So the criminal law is really about the duty of disclosure. So people who have not disclosed before sex that pose a realistic possibility of transmission or at risk of prosecution, whether HIV was transmitted or not, and whether they had an intention to harm their partner or not. So in terms of the current state of the criminal law, we have the latest decision by the Supreme Court of Canada, because this is not something that is written in the criminal code. The legal duty to disclose under the criminal law is something that was established by the Supreme Court of Canada that interpreted general provision of the code. So this is why we refer to the Supreme Court. And what the Supreme Court say in 2012 is that people living with HIV have a duty to disclose when there is a realistic possibility of transmission, and they say there is no realistic possibility of transmission if people use a condom and have a low or undetectable viral load. And so as a result of this decision, people might be at risk of prosecution if they don't disclose their status and they engage in sex without a condom, or if they don't disclose their status and they engage in sex with a condom but they don't have a low and or undetectable viral load. Um, the 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 law hopefully might evolve because, as you can understand, based on your understanding of HIV risk of transmission, it really needs to catch up with the science. We know that condoms are an efficient way to prevent transmission, and we also know that treatment in itself is an efficient way to prevent transmission. But still, it seems like the Supreme Court is requiring both. Or disclosure, and that if a person cannot prove that they both use a condom and have a low viral load, they could be at risk of criminal prosecution if they have not disclosed their status to their sexual partner. So that's really problematic. It might evolve, and there are some cases that are already showing that evolution is possible, but so far it is safer for people to assume that this is when they have a legal duty to disclose. In terms of other sexually transmitted infection and whether the law only applies to HIV or other STBBI, it's complicated. In 1998, the first time the Supreme Court decided that the criminal could be used against people who have not disclosed their HIV status, did say that the criminal could also be used to address the risk of other sexually transmitted infection. But how the legal test will be applied in those circumstances has yet to be determined. It's also unclear which other sexually transmitted infections might be considered so serious to trigger a legal duty to disclose under the criminal law. And at present, I've only seen a handful of cases involving sexually transmitted infection, mostly herpes. But when I say a handful, like really just like 3 or 4, when we've seen more than 180 people living with HIV charged with HIV non-disclosure. So the criminalization of HIV non-disclosure is very serious. We've seen that many people have been charged and that the charges are extremely severe and have very severe repercussion for both people living with HIV, but also for public health more generally, because it could discourage people from getting tested in the first place. If knowing that if you're HIV positive, then you will have a duty to disclose, and if you don't, you might be criminalized. It might also discourage people living with HIV from accessing services, especially as medical records and records of service providers have been used in criminal investigation. So that's something that really needs to be taken into account, and you need to remember. And because HIV is singled out, and because the law allows for prosecution even where the risk of transmission are extremely low, so even when the condom is used or when a person has an undetectable viral load, the current use of the criminal law clearly reinforces stigma and discrimination against people living with HIV. And as I mentioned, it can also undermine the relationship of trust between client and service providers, because your medical records may be used in criminal investigation. And further, the criminalization of HIV non-disclosure may contribute to this internalized and perceived stigma that we discussed, and it may therefore also contribute to a client unwillingness to discuss sexual health or disclosure practices with their service providers, or to seek HIV testing. So those really are important considerations for you to keep in mind when working with people living with HIV, or when working with people who are thinking HIV testing. And because criminal prosecution have very serious repercussions for people living with HIV, I think it's really important for people living with HIV and for people who are seeking HIV testing to know about the law so they can make informed decisions about their life. And community-based organization in particular, are often the best and or only source of information and support for people living with HIV. So it's really important that there is some kind of discussion and resources available around this, so people can really know and understand what their legal obligations are, and so they can protect themselves. Of course, when you're gonna discuss, if you're gonna discuss those issues with your clients, it's important for you to think about, the complexity of this issue, and the impact that it can have on your client and emotionally, and make sure that also the language that you're using is accessible, and also make sure that you're not providing legal advice. You're not authorized to provide legal advice, but you can provide general information. So when providing information about the law, I would recommend that you provide clients with written material on the criminal law and HIV from reliable sources, and that you have appropriate referrals as well if they want to have further information on HIV criminalization. So the Canadian HIV/AIDS Legal Network has a lot of resources that you can use. And also remember that counseling does not stop there. Service providers should work with their clients with the intent of promoting overall health and well-being, including minimizing the adverse and negative effect of disclosure if the client actually chooses to disclose their status. So, and you should remember also that service providers' record can be potentially seized in the context of the criminal investigation. So some clients may want to seek legal advice before discussing with their service providers issues related to disclosure or their sexual practice. So again, just in this idea of really creating space for maintaining trusting and supporting relationship, it's important to talk about disclosure issues and sexual practices, but also recognize the real experience of people that you are meeting, and how those real life experiences are much more complex than what the criminal law may suggest. So that's something very important for you to keep in mind. And as discussed before, that disclosing your status is something that can be very difficult and challenging for people, and could potentially, in some circumstances, expose them to risk of violence or abuse. So it's not necessarily in all circumstances a positive thing. And I think really respecting where each client is individually can help alleviate the stigma that they experience more generally. So to summarize, the role of service providers when it comes to dealing with this difficult environment is to remember that the role is to provide care and counseling for clients. You can provide, and I think it's important to make sure that clients have access to information around the law, around the criminal law, but also around some of the public health law that can also have an impact on their life, and to provide clients with written materials from reliable sources. But again, remember also that your role is to work with clients to promote overall health and well-being, and minimize the adverse effect or negative effect of disclosure if they choose to disclose. Your role is not to provide legal advice. but again, provide some information is important. Your role is also not to enforce the criminal law. It's about providing care and consenting for your client. You don't have an obligation to report a crime to the police. You also don't have an obligation to inform a client about their possible option to press charges against a sexual partner who may have exposed them to risk of HIV. And you should not go to the police unless it's absolutely necessary. Associating, if service providers and health providers are associated with police, that of course can have a very bad impact on the way people will see and perceive health services, and it could really impact their trust. So I can see that it's already 2:18, so I'm gonna go a little bit faster. I just wanted to mention this because I know that some service providers might wonder if they have an obligation to warn someone who might be at risk of HIV, for example, or another STBBI transmission. And I just wanted to say that there is no outright obligation to warn. As far as I know, I've never seen a case where service providers has been, where court has said that they had an obligation to warn someone who was at risk of HIV or at risk of sexually transmitted infection. That being said, there may be some really exceptional circumstances where a service provider might feel compelled to intervene. And based on some guiding principles that were established by the Supreme Court of Canada in 1999, service providers who have a duty of confidentiality have the discretion, not the obligation, but they have a discretion to disclose confidential information about a client to prevent harm to another person. And that possibility exists when there is a clear risk of harm to an identified person or group of persons, and when there is a risk of serious bodily harm or death, and when the danger is imminent. So those are the conditions where you might have a discretion to disclose confidential information without the consent of your client. But again, it's really hard to know how this principle would actually apply to STBBI transmission. And I wanted to highlight that regulated professional and public health law as well sometimes have also some rules that applies to in what circumstances you might be able as a health professional to breach confidentiality to protect others from harm. So I just wanted to highlight that, and just highlight as well how, like, if you have a discretion to disclose in a particular situation, or you think you might have a discretion to disclose, how this decision to breach confidentiality need to be taken like really carefully, and it has to be carefully thought through. And how like service providers should do everything they can to limit as much as possible any breach of the confidentiality of their client, and that they should also inform their client about any action that they will be taking before taking that action. So again, it's really intervening and breaching confidentiality in order to protect others or to protect public health is really about finding a balance between the rights of an individual and the need to protect the community. And it's really important for you to consider first whether all the voluntary measures have already been undertaken, and really assess the risk based on the most recent and accurate medical evidence, not based on your on some assumption or based on as this climate of fear and surveillance that, for example, is being reinforced by the criminal law that is not even based on medical evidence, and think about how coercive intervention from service providers and public health can also reinforce stigma and discrimination against targeted group. And so generally speaking, the least intrusive, most effective graduate approach should always be followed when looking at how we can balance the rights of an individual and the need to protect others and public health. So I realized that we covered a lot of different topics. I hope this is not too overwhelming. I want to mention that the information that is described in this webinar will be available in an info sheet that we developed with CPHA, and that's going to be available early in 2017, and then we have really a lot of different resources listed in these slides, including on the website of the Canadian HIV/AIDS Legal Network that goes into all these different issues. And I'll be also very happy to respond to your question.
So thank you, Cecile, for that very informative presentation on a fairly complex but really important issue, especially when we're thinking about how to address stigma and discrimination within service settings. So as Cecile said, feel free to contact either myself or Cecile if you have any questions. And this webinar recording, as well as the slides, will be made available on CPHA's website in the coming weeks. And then lastly, before we get into questions, there is a link there for an evaluation survey. So please do take a few minutes just to fill that out. That will help us get a better understanding of whether this information was useful to you and how we can better improve